Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to our series exploring strategies to enhance health literacy in healthcare. In the previous episode, we defined what health literacy is and discussed the widespread impacts that low literacy skills can have, like outcomes on medication adherence, care comprehension, and healthcare use. So in this episode, we're going to be focusing on how to build health literacy skills and some practical tools like some assessment methods, teaching techniques, and overcoming literacy barriers. And if time allows, we would also like to kind of zoom out a little bit and focus on some system level approaches towards becoming a health literate healthcare organization, like types of environmental changes, some institutional wide policies that could help with reducing literacy related barriers to quality care. Joining me to continue this discussion is Dr. Kathleen Wolf. Thank you for joining me again to continue this discussion on health literacy.
I'm happy to be here.
Yes, absolutely. In healthcare, Kathleen, you know we assess a lot. We assess all the things, we assess everything. So that's really the starting point for almost everything that we do in our roles. So how do we assess health literacy in an effective, but yet also being sensitive in the way that we do it in our patient interactions?
I think it almost starts whoever has the initial contact with the patient. So whether that's your front desk person, whether it's somebody on the phone, whether it's at a health fair and you're introducing yourself. But I think that initial contacts, as healthcare providers, we have excellent assessment skills. As you said, we've been brought up to assess everything. We all know that we can talk to people and get a really good feel for a lot of information by just having a conversation.
Yes.
And sometimes it's a very innocent conversation like, oh, we're a primary care provider. Oh, really? What kind of patients do you see? We see all patients from birth to, old age. And then they say, oh, I haven't seen a doctor in 10 years. Oh, really? Why haven't you seen a doctor in 10 years? Mm-hmm. Well, my doctor died. And I just haven't found anybody I liked. Okay, well, and it can start as something as very simple like that. Mm-hmm. And then based on that, you start to identify now if the patient has just kind of told you he hasn't seen a doctor in 10 years, which probably means there's something going on and he needs to see a doctor,
right,
but he's not 100% sure, but there's something that he's concerned about. So I think it's that initial contact that really starts the ball rolling and starts that assessment process. So that person has to be the one. They can determine whether the patient, if English is their native language, and just looking at the patient, are they disheveled? Are they, is their color off? Are they breathing heavy? Are they sweating a lot while they're talking? And there's just so much power in that initial assessment. So it kind of like helps you start to see the field, like maybe this is not a person who has put their health as a priority. Maybe this is not a person who has felt like the healthcare system has been good to them. We've all heard these horrible stories where the patient has said, I've gone to a healthcare provider. They were judging me. They wouldn't help me, blah, blah, blah. Or I don't have an address. I'm homeless. That's going to be a whole different health literacy challenge than someone who comes from a very high and exclusive neighborhood where you're not worried about food and just basic necessities. So I think whoever that initial person is or that initial contact, they can get a lot of that information. And that kind of starts it. So then once they do that, then it's a matter of getting them into the system. I think we have to be very cognizant of that too, because I think one of the problems that we do is if I decided I've not been to a doctor in 10 years and I want to go to the doctor, I don't want to call the doctor and you tell me it'll be 6 weeks from tomorrow is my earliest appointment.
Yes.
Because now I think, well, see, there mustn't be anything wrong with me because I told her I've been coughing for a month. And if I was really sick, I'm sure she would have told me I needed an appointment. So again, without them realizing that it has absolutely nothing to do with them, it has to do with a scheduling issue. So I think sometimes we have to be very careful not to give the wrong information or have the patient assume we've made a diagnosis or decision based on what they're bringing to us.
Right.
If we're going to minimize what they're saying and their level of, and their, whatever their level of health literacy, they're going to feel like they're okay now. So it's okay if they wait, I think also that we have to be careful about the fact that healthcare has become now more commercialized. There's a lot of big companies like Amazon that are buying into healthcare products. So they have their own, online urgent care system. Well, I bought my shirt at Amazon. It worked out. I might as well now get my healthcare at Amazon.
Yeah.
So, you know what I mean? So I think we have to be very aware that it's not a one size fits all, and that most of us don't have millions of dollars worth of budget to market our products and market our services. So again, it starts really with that initial person, what they read, how they see it in the media, how they're seeing it on Facebook and TikTok and Instagram, who they're talking to. If your group has the same health literacy as you, then that's not really the best support system for you. It's kind of like, smokers hang out with smokers, drinkers hang out with drinkers, drug addicts hang out with drug addicts. You hang out with the group that mostly reflects you. Do you know what I mean? So I think that we have to be careful that we look at maybe formal lines of education in order to educate individuals. All people in the United States have to have health class. Maybe health class needs to start focusing on how to navigate healthcare. They've tried navigators in the past for healthcare. As we talked about on the other podcast, it's hard to navigate healthcare. It's hard to navigate healthcare when you work in healthcare and you understand healthcare. It's still hard. To not be in healthcare and try to navigate healthcare is a disaster. The problem is the hospital's healthcare navigators, which they have, are available 9 to 5, Monday through Friday. Well, my healthcare problem doesn't usually occur 9 to 5, Monday through Friday. It occurs Saturday night. Yeah, exactly. Saturday night, 10 o'clock. And guess what? I am sick and I don't even know who to call. So what do? I go to the emergency room, which is like the worst thing to do. And I sit there for 5 hours and then I decide I leave. I don't get seen and I'm never going back to healthcare because again, they don't care about you. So it's the way we're being perceived and where we're starting that education at. And truly, it needs to be almost like the first touch, and it needs to start at a much younger age. We need to be starting in probably preschool, starting to educate people. How do you navigate healthcare? How do you seek out healthcare? What's important for you to know about healthcare? We're starting way too late. If we're waiting till they have a problem, we've already lost 90% of our chance to really make an impact.
And I think a good example, I have a good example of this is my husband is far away from healthcare. He doesn't have anything to do with healthcare. I have, been in healthcare my whole career, basically starting out as like a pharmacy technician in nursing school and then, working my way through it. Well, I have a daughter who is, her eyes started crossing and she started getting headaches. And I'm in Arkansas and our provider's in Florida. And so he calls them for me and they're like, well, our first opening is in June. And so, you don't know that you could be like, can I have a phone consult? So I'd already coached him through it. And I said, see if I can have them call me, let me walk them through what's going on. And so like I have one this month, they're like, we're going to fit her in now that we understand what's going on and what's happening and, and they'll work with you. But, if you're not in healthcare, do you know what all the options are? Do you know that, yes, you can go ahead and book that appointment, but you can ask for a phone consult. Like, hey, can I just talk to the nurse? Can I, talk to somebody about what's going on? And if they see that you need to get in earlier, a lot of times they're going to help work you in and try to get you in. But a lot of people don't know what their options are in order to be seen. They don't know what preventative care is versus supportive care. And so most of the time it is just supportive care. Because even I'm not sure, like, My husband gets physicals every year because, the military wants to make sure you are fit and you are ready. And I'm like, do I need to go every year?
Yeah.
Do I get a physical every year? Because that's not something we talk about.
Right.
We don't talk about preventative care very much. So what are some ways that we can help with those who don't really know what all the options are, really start to understand preventative care versus supportive care?
I believe, and I try in my practice, every exchange with a patient, you bring up preventative care. Every patient who's over the age of 45, we talk about colonoscopy. Nobody wants one, but we talk about it. Do you know what I mean?
Yes.
I think, the UST, United States Preventative Task Force, has an app. And most providers have it downloaded on their phone. They can put in their age, and then it pulls up exactly which preventatives they need. People are pretty good. I will say young women are pretty good about pelvic exams. They kind of know, not till the age of 21, then every 3 years to 30, and then 5 years if you're HPV negative. They're pretty good about that. Not so good about mammograms, not so good about breast exams. So there are things that we've done a very good job with. And I think pelvic exams and pap smears, we've done a very good job educating people. I think things though, like vitamin D, we still struggle with. Blood pressure checks. I mean, it's the number one issue in healthcare in the United States is undiagnosed hypertension. And it causes so many problems. And yet they removed all the blood pressure, at least in our area. There's no more drugstores that have the little blood pressure cuffs in them. It's all gone now. Well, because they've replaced them a lot with urgent cares. The little, the little provider in the pharmacies now. So they'll check your blood pressure, but it's a provider visit. So you're seeing this change where everybody would go and get, I got my blood pressure checks at Osco and it showed that I was elevated. So I made an appointment. It was a way to send them. We're not seeing as many health fairs anymore because of COVID. So I think once we start getting back into a lot of these health fairs and blood pressure checks and some of those things, I can remember pre-COVID at the clinic, they would have the Lions Club come in once a year to do eye exams. They have the Rotary Club come in once a year to do ear exams and hearing testing. They had student nurses come in to do some hemoglobin and some blood sugar and blood pressures. And then COVID hit and we all moved away from a lot of those things. And those things helped to identify a lot of patients that were asymptomatic, that were having some underlying issues. So I think we need to go back to those kind of things, having those health fairs. I think we need to be more invested with employers and doing more preventative. Again, kind of fell off during COVID. Providers were pretty good about you get a discount on your insurance if you have yearly labs, a yearly physical, a mental health test. We do PHQ-9s on every patient to assess their mental health. And I think that's really important. We wind up picking up a lot of depression, and depression that's masked as anxiety. A lot of people do not understand that anxiety is a form of depression. And if we can treat the underlying depression, we can address the anxiety without throwing benzos at you. And so I think that, doing PHQ-9s in practice is such a wonderful thing. TB screenings, we can have a potential for TB outbreak because, again, we're getting into people that are coming from endemic areas. So, back to the TB screenings that we used to do on everybody, PPDs, everybody in healthcare had them, and then we got away from them. Heights and weights, we're all, I don't know about you, but I'm always surprised when I get on scales like, well, now how did that happen? It's like,
yeah,
I can't believe I did that. And again, I think it's just that we have to really start educating people on preventative care through a variety of mechanisms, whether it be the health fair, whether it be the schools, whether it be the media. We just have to, whether it's a flyer, we just have to get that information out there, the importance of getting this stuff done. And, and the guidelines keep changing. Now they're saying colonoscopies after the age of 40s because the biggest risk for colon cancer now is 20 to 30s. that's really scary, because if we're waiting to 45 or 50, we're going to lose a whole lot of people. And so it's like, how do you educate people that, hey, these guidelines are changing. We need to get this information out there. When, I had difficult time keeping up with all the new guidelines. So, it's like, again, I think there was a lot of community involvement before with other agencies. And I think we've kind of gotten away with that with COVID and then funding issues. And we need to get back to those directional agencies and the working together. You take a nursing school, works with the college to do a health fair, or a community church that asks for volunteers of their congregation to help them with a health fair. I mean, we have to start moving back into those kind of situations. It's a good way to hit a lot of people in a very small geographic area.
Especially those who would rather go see people that they know rather than go to a clinic, and that's another way to really help them with understanding their options that are out there. So when it comes to families coming in, what are some ways that you can collaborate with patients' family members or even their caregivers just to help with reinforcing that health education?
I find that usually it's funny, because usually when families come in, we get a lot of young families, and it's easy when you have the mom on your side. It's very easy. Most of the time they come with the mom. I'm not saying the dad wouldn't be as important, but most of the time you're seeing the children with the mom. And it's really easy to talk to a mom about her children, and she's 100% vested. It's a little harder when you talk to the mom about the mom. Do you know what I mean? Because the mom is like, well, yeah, I know I should have done that, but I really don't have time.
Yes.
I'm working, I'm cooking dinner. I know we shouldn't eat out as much. I know, but I work all day and I come home and then I'm tired. And I just had this conversation with my son, and we were talking about, 50 years ago, the mom was home all day. You would come home. There was no processed foods. It was just straight up, healthy foods. Everything was made from scratch. It was not huge portions. There wasn't a lot of salt in it. And that's the way it was. And, that era is gone. Okay, it's gone. So now we have to address these issues with today's era. So then we talk a lot about like meal prepping, and we talk about myplate.gov, which is a really good resource that we use with our clients a lot. We go on the site, we walk them through it, kind of help them decide how to make healthy food. We talk a lot about the cost of food, because, if you live in a food desert, food is expensive, especially healthy food. So then you talk about, okay, how can you achieve the same outcomes without spending a lot of money? We all know you go to Costco's, you can get a box of ramen, 24 boxes of ramen for $3 that can feed your kid for 2 weeks, versus you go to, another store and you buy steaks and, you can't even get a steak for $12.
So you're talking about that MyGov, myplate.gov. And I just wanted to say that I taught a nutrition class to undergraduate nursing students. And that one of the assignments that I would give them every semester was, I want you to track everything you eat for like 3 days. And then I want you to go to, compare it to mygov.plate. They would also, track all of their calories, all of their fat, all their sodium. So they got to see over 3 days. I'm like, I don't want you to change how you eat. I just want you to write everything down. I think we used an app where they could like put all their foods in. So it gave them a breakdown of everything they ate. And then they compared it to myplate.gov and how to write like a little assessment of their own diet. And you don't realize how much fat you take in, how much sodium you take in. You don't realize just how off your diet is until you really just sit down and you're like, it was very eye-opening for a lot of the students. It was a really good assignment for them. They all really enjoyed it, and they learned a lot about themselves. I mean, our diets are not what we think they are. Even if you think you're eating healthy, it is not what you...
Well, and our food is not clean either, but that's a whole other... Do you know what I mean? There's additives in the food. But I agree with you. I think that's an excellent idea. I think even reading labels. I mean, I was pretty old when I figured that I should be reading labels, because I think we just trusted that, well, this was good and it says, whole food on it, and we went that way. So I think our food source, our diets are a huge part. and then also exercise. And I think, you can start with patients. I think where we really run into a problem with patients when you're trying to help them on their health literacy education is we give them too much to try to do at once. Okay, so I want you to clean up your diet. I want you to lose 40 pounds. I want you to start exercising. I want you to quit smoking. And I want you to no alcohol. Okay, any questions? And I'll see you in 6 weeks and we'll judge your progress. And I think we kind of blow it because we're like, okay, you can't do that. It's like the person that has a heart attack and they come home from the hospital and they're like, I'm not going to smoke. I'm not going to drink. I'm going to lose weight. I'm not going to eat meat. And within a week, they're back to doing all those things they were doing. And I always say to people, it is just pick one. Just one bad habit is where we're going to start. Just one modification. So if you don't exercise, how about going for 3 30-minute walks a week? That's all you got to do. Or if you have a bad diet, you eat a lot of processed foods, how about adding 1 salad 4 times a week? And start with very small, obtainable goals. And I think once they see that they are reaching these goals, they become very proud of themselves. And they also feel better, and that reinforces the needs to continue. And you can do the same thing with preventative care. Okay, I want you to start taking vitamin D. Okay, and just start taking it so many units once a day. And let's see how that does. See if it peaks up your energy. I want you to have a mammogram. Let's just start there. Let's just get 1 mammogram. We don't have to talk about the colonoscopy right now. Let's just do the mammogram and see where we go. And once they start to see that they can successfully navigate these, I think it builds confidence in them to keep going. But again, I think it's we overwhelm them. I mean, we're overwhelmed in healthcare all the time. It's like you go talk to a lawyer. My sister's a lawyer, and I don't even understand half the time what she's talking about. Do you know what I mean? Like I just sit there and think, I didn't even know what you just said. So she constantly overwhelms me just because of her language. And then I stop and think, gosh, am I doing the same thing to my patients? Like just constantly overwhelming them by saying things. So I think saying things, and then one of the things that I found has been really good for me is if I have a script for something, whether it be preventative care, whether it be a medication, some medications, especially medications that we're using off-label and stuff, I have a script where it's all written out with the pros, the cons, frequently asked questions. And I go over it with the patients, and then I send them a copy. And I always tell them, I'm just going to give you a copy. When you go, it's a lot of information I threw at you. Go home, read it through. Let me know if you have any questions. And it's just a really nice way to reiterate what you said in the office, where it is overwhelming. I've been told things in the office and walked out there saying, I wonder what that was about.
Yes. And I think it's good to bring in, a family member when you're talking to them. Maybe they understood it better than the patient did. Maybe they took it in better than the patient did. And also having somebody that's got your back, somebody that's rooting for you, somebody that wants you to be successful, that can help you be successful and with your goals. So, yes.
And I think it really helps if they want them there. We've seen the other side too, where you got to know your audience. If you do have a family member that's very involved, that's perfect. Like you said, it will really help. And it could be anybody. I've had grandmas, I've had, moms, dads, siblings, it's anybody who really kind of has a support, compassion, empathy to help that person grow with that. And then I've had other ones who said, no, I want to go on this journey myself. I don't want anybody else involved. So I think, again, it's just trying to figure it out. A lot of times once they establish a relationship with someone, they feel a little more comfortable. I think anything you can give the person to support them in this journey, education wise, sometimes free samples. We didn't even touch on medication. We didn't touch on medication. We haven't touched on Google. Medication is so difficult. Medication is so expensive right now. There's so many shortages, and a lot of people are getting their medications outside the country. And then you're trying to figure out what this medication is. I know it's supposed to be metformin, but I can't vouch for if this is metformin or not. I know this is supposed to be an antibiotic, but I can't vouch for it. And so we struggle a lot with people getting medication that don't need to be on it. The other thing that's happening a lot in healthcare is people are seeing people who in an urgent care or a quick care who quickly diagnose them and put them on Adderall, or they put them on a psychotropic, or they put them on some other sort of medication, which is great, but they don't follow up with them. And now all of a sudden I am faced with a patient who's on 80 benzos a month. You know what I mean? And I have to figure out how to navigate this. And their health literacy is, I need this medication to function. Do you know what I mean? And it doesn't matter about anything else you have to say. So then you have to try to figure out, again, a path to help that patient achieve their maximum health, but not all the side effects that 80 tablets of Xanax is going to cause them in the course of a month. So, and then Google, everybody Googles. And then they come in and they say, I Googled this, I have cancer. And then you're like, you do. But so I don't get offended by it, because as a nurse for a long time, I used to go to my doctor all the time and say horrible things like, oh, by the way, I think this mole is melanoma. And they'd be like, why do you think that? I'd say, oh, because I looked at it. Do you know what I mean? And then I looked at my book. So I think that that's normal nature. And then I think, again, it's up to us to educate them out, like, that's a possibility, but let's take a step back.
Yeah. Let's figure out what else it could be besides jumping to that one. Absolutely. Right. Well, I want to real quickly kind of zoom out a little bit and really look at the healthcare system. So how can that physical design of your healthcare facility really play a role in either promoting or undermining health literacy?
I think part of the problem is in the United States, we are not in the business of health. We are in the business of disease. And until we change our mindset and stop being so disease focused, now we're just, you got a cold, you get an antibiotic. You got a sore throat, you need an antibiotic. You're overweight, we'll give you a GLP-1. We're just in the business of treating, and we're not really in the business of prevention. And I think what you need to see is we need to see healthcare systems really commit to healthy lifestyles. There used to be initiatives like healthy people by 2020 or something. There was 9% birth infant mortality by 1999. There used to be huge initiatives that only looked at health outcomes. And where are they? Where are the health outcomes anymore? Do you know what I mean? We're not looking at health. And until we start to get back to that, we're not going to help people understand health literacy, because all they're understanding is disease. Right. So until we change that and we become more promotion in health, I think we've made strides, non-smoking areas, tougher laws on alcohol. But you know what? We're not addressing homelessness, which is huge. We're not addressing substance abuse at the level we should be. We're not addressing safe neighborhoods. We're not addressing employment. I think there's so many social parts to healthcare that we almost need that multifactorial approach. It's not going to be, we're not going to fix it. They're not going to fix it. We all have a piece in getting it moving. I thought really universal healthcare was going to be a really big push. And I thought that was going to be one of those factors that was going to make a huge difference. Unfortunately, universal healthcare has just caused more problems because people don't understand that even though they went online and they bought insurance, that insurance covers nothing. Everything is out of pocket. So even though they think I only have to pay $200 a month and I've got this great plan, physicians don't take it, providers don't take it, hospitals don't take it. It's like they really hurt themselves doing it. So I just think the whole system's going to have to really rechange what its focus is. And until it does, we're all going to be just out there piecemealing and trying to figure out how to get people better educated. Start younger, push them harder, change the media. But, if we're going to stay commercialized and illness focused.
Yeah. Well, and I think that health literacy not only goes with supportive care, preventative care as well, but, also with insurance.
Absolutely.
You go on there and I remember trying to help, some patients who were older and they were trying to understand, well, what does this mean? Like, well, what is this one? And I'm trying to compare the two. And even I'm like, I'm not sure. I don't really know what to tell you there. So, and it's almost like it's a game to get you to buy the cheapest one. And you still got to pay so much money out of pocket, but then the insurance doesn't have to pay as much. And so, the health literacy and just being issues are not just in being treated is also in insurances.
Oh,
Yeah,
absolutely.
healthcare
Insurance is my
insurance.
nightmare. It's just my nightmare. I don't understand insurance, and I thought I was pretty good at it until I try to navigate everybody's insurance, and then it's a nightmare. And then it's like, well, how can you not pay for this? Like, how
Mhm.
can you not pay for this, but you pay for this? So, yeah, again, it's medicine needs to stop being ran by businesses. It needs to get
Mhm.
back to being a medical provider. I get that we need businesses, but at the same time, we're not Ford. We're just not. We're not Amazon. There is
Mm-mm.
such a different component to this.
Absolutely. Well, as we were kind of talking through this, some factors that have really stood out to me regarding health literacy is that when we work with our patients, we empower them. We empower them to take control of their health and to be able to get the things that they need for supportive care and preventative care, which is really going to improve our patient outcomes and overall reduce so many of those health inequalities that you were just listing. So I know that there's more to health literacy, but what really stood out to me is that when patients understand health information, they make informed decisions. They engage better with their healthcare providers. And when patients understand, they are more likely to engage in those preventative health behaviors that they probably didn't even know existed. They're going to adhere to that treatment plan better, and they're going to be able to more effectively manage their chronic conditions, which we're seeing a lot of in the US right now. So these were some of the things that I kind of took away from our discussion today that I really wanted to emphasize. But as we come to the end of our time, Kathleen, what do you want to emphasize to our listeners?
I think we have to use the apps. I think we have to be stewards of teaching people how to use apps. There's some great apps out there. We talked about myplate.gov. There's also the United States Preventive Task Force. There's so many things that patients can get on and see apps for health, for
Mhm.
mental health, for stress, for anxiety. Reminders that it's time for your mammogram, like tickler files. There's so much out there with using technology. So I think we just have to kind of be the stewards of helping them sift through Google information, helping them sift through Instagram and TikTok, the influencers. It's not going away. So we as
Mhm.
healthcare need to be empowered to help them navigate that because none of those things are going to go away. So how do we help our patients separate out what's really important from just someone trying to make some money?
Absolutely. Well, that brings us to the end of our comprehensive look at tackling the health literacy challenge that we're seeing in healthcare. And I hope that you have really enjoyed our discussion on this timely topic. And Kathleen, thank you so much for
Thank you.
joining me through this series. Just to kind of recap these two episodes, we covered a lot of ground exploring what health literacy is and its far reaching impacts on outcomes and costs, and most importantly, some strategies to help with creating more of an understandable care experience at both the provider level and a little bit at the system level. But if we're really going to enhance health literacy, it's truly a team effort that's going to
Mhm.
require a multi-pronged approach across all of our patient touch points, just as you were talking about, Kathleen. By implementing even some of those evidence-based topics that we covered here, healthcare providers and our organizations can really start to dismantle those literacy-related barriers and help with creating a more equitable care environment. So at the end of the day, our ability to effectively convey health information and really cultivate patient understanding is foundational to delivering high quality, safe, and really ethical care. Because low health literacy perpetuates healthcare disparities and it really prevents truly informed decision making. So it's an issue. It's an issue that impacts all communities that we must prioritize and address proactively. I encourage all of you to take the insights from this series and really work to become champions for health literacy improvement at your respective institutions. Share these strategies with colleagues, start conversations about current practices, and really keep advocating for patient-friendly policies and resources. And I also encourage you to explore many of the courses that we have available on elitelearning.com to help you grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.